To all the people who are sitting here and not part of Tall Tales, thank you so much. You are so good for my ego. And to all the people who have left, my sympathy is with you because you are going to miss being a part of history. On that note, let me introduce Tall Tales to you. We at Ophthaeva believe that what men can do well, women can do much, much better. So, men are proficient at making tall tales. For example, yesterday evening, our Scientific Society chairman, Dr. Doel Biswas, at 10 o'clock, got a call from his wife asking, "Where are you?" And he said, "I am doing OT at 10 o'clock at night." OT? Yes. Doel has dropped a nucleus, the Shushruth OT is closed, and she has sent the patient to me. So, where was she? Where was he? He was with the secretary, Dr. Debashish Das, and they were watching the World Cup over a glass of whatever. So, tall tales have always been the purview of men, but here the women are going to take over the stage. May I call upon the chairperson for this session, Dr. Kajol Prasad Ghosh, to come ahead? Kajolda, are you there? Please, Kajolda. The judges, some of my favorite speakers, Dr. Arnav Mitro, Dr. Parag Mukhopadhyay, leader of the Brat Pack, Dr. Rudra Prasad Ghosh, and Dr. Shurja Gupta. Do we have all Adams as judges? Well, to add that one touch of sensibility, on the spot, I request Dr. Vaishali to join the group. We need some balance. Before I tell you the rules, let me introduce the teams. We have the sensational sirens, comprising of Dr. Chandana Chakraborty. Chandanadi, please stand up. Dr. Himani Chatterjee, Dr. Brototi Roy, and Dr. Sneha Jain. They are the sensational sirens. The devilicious divas, Dr. Oindrila Das as captain, Dr. Devolina Bhattacharjee, Dr. Madhurima Kumar, and Dr. Ritoja Das. Can you wave like celebrities at the few audience that you have? The stunning sonoritas led by Dr. Madhurima Mukherjee, Dr. Bidisha Roy, Dr. Deepsha Chakraborty, and Dr. Sampurna Mukherjee. The breathtaking bellas, Dr. Sashwati Biswas as captain, Dr. Debaroti Mukherjee, Dr. Kalpita Das, and Dr. Rituparna Chatterjee. And last but not the least, we have the mesmerizing Madonnas, led by Dr. Suchanda Sar, Dr. Anuradha Chandra, Dr. Moitri Das, and Dr. Shruti Anand Prada. Oh yes, Dr. Moitri is unwell, so we have Dr. Aditi, who has kindly stepped into her place. And with me, helping me along, is Dr. Ankita Raj. The rules of the game are very simple. Shh. You will be shown a picture and a sentence. I will read out a sentence. Now, each team comprises of 4 people. The first person, you decide among yourselves who starts, will start the story from that sentence. The second person will then, the first person will speak for 1 minute. The second person will then continue the story for 1 minute. The third person will continue from that 1 minute. And the fourth person will end the story in 1 minute. Is it about ophthalmology? Of course it's about ophthalmology. We are all eye doctors. Is it about science? No, it's about fun, it's about wit, and it is about absurdity. So go for it. Just to give you an example, perhaps you have the picture of Modi ji, and the sentence may be that when the PM walked into my clinic with a black eye, and you continue the story, right? So, the first team, and I would like to go according to the sequence, but I have been requested by someone that she has to leave for her daughter's sake. So I'm going to start with the breathtaking bellers. Can I have Shashwati, you and your team come up here?
Can I show the first slide now?
Yeah. Can you actually give them another hand mic? Because they don't need a presentation. So come up here. All four of you, come up here. Tulika, you keeping the time? It's up there. So 1 minute and you have to pass on the mic. Otherwise, judges, please remember, they will be deducted marks if they go beyond 1 minute each speaker. Are we ready to go, team? Silence, yes. Anyone, you decide among yourselves, okay? So
Hello.
this is
Hello.
the breathless bellas. And the first person to go, what is your order going to be? Yeah, I know that, first, second, third, fourth, but okay. It's going to be first, second, third, fourth. You don't need to know who they are, just
Hello.
go marking them like that. Right? Are we ready? Yeah. Shashwati, ready? Okay. Here comes your first picture. The timers, they started timing me, huh? Okay. This is the picture, and it says, my mouth wouldn't shut when I saw who my next patient was. Your time starts now. Go.
ঝমঝমে দুপুরে হয়ে যাক মজার গল্পরে এর কোনো মানে নেই আছে শুধু হাসির মোড়কে আমি বাংলায় বলছি গল্পের নাম মিস্ট্রিয়াস আই আমি অবাক হয়ে গেলাম যখন দেখলাম আমার নেক্সট পেশেন্ট কে আরে এ তো খুব মজার লোক চোখটা লাল লাল লাগছে না হ্যাঁ হ্যাঁ লাগছে লাগছে আমি ভাবছি কখন সে আসবে আরে আসছে হ্যাঁ হ্যাঁ আসছে আসছে বেশ ভালো করে আই ইচিং হচ্ছে দেখতে হবে কি কারণ আচ্ছা আমি আমার সব জিনিসপত্র ঠিক করে রাখলাম নিজেকে একটু আয়নায় দেখে নিলাম ইয়া আই এম লুকিং গর্জিয়াস ওকে আমি এবার দেখবো আমি সে এলো হ্যাঁ হ্যাঁ দরজা খুলে এলো এলো
Shashwati took too long to do her makeup, so by that time he was getting a bit late for his shoot, so he came into my clinic. I said, no, I'm not an anterior segment specialist, but he insisted that he was in a hurry. So as usual, I dilated him because I like his eyes very much. I've always been fond of the color of his eyes. I fantasized about him when I was young. So I was very happy to see his retina also, along with his other features. And after I examined him thoroughly, I gave him the diagnosis that maybe he has been crying a lot after Suzanne and Kangna has also pressed charges against him or is slandering him. So then he was not happy with me and he was like persistent that he has some...
So what happens? So I saw there's a small insect which has gone inside the eye. Oh, insect. So I found out the cause. Now, where is the insect? I cannot see you. Now, I feel enough time to find out the insect. I evert the upper lid, I evert the lower lid. I cannot find. Then I think, if possible, that has gone inside the eye. So I'm a posterior segment surgeon. Can it be inside the eye? Oh, I dilate and I see a spot. I tell him, maybe, okay, it is the larva migrans which has gone inside, creeping through the eye. What it can be? So I find out, okay, I decrease the light, increase the light, and I see the larva moving inside the eye. Oh, now it's vanished. Where it is vanished? Again, I started seeing everywhere. And he's like, what are you doing? But obviously at the same time, I'm only looking at him. I'm not doing anything else because there is nothing inside the eye.
Oh my God, and with all these things, my hero, my Hrithik Roshan got so irritated. He was shouting, he said, oh my God, my eyes are itching, and what are you saying? Where the insects come from? I said, and my previous surgeon said, the insect has gone inside the brain and all, what are you saying? And then, but my dream was to look into his eyes, the eyes that I have been fascinated right from my childhood. I was looking at those deep brown eyes. I was making him sit in the street lamp and I was looking and looking into the street lamp. And then suddenly I heard a noise. hey, come on, get up. What are you doing? And it's my mom, Rituparna, get up. You're dreaming. You're shouting. So it was just a dream. And it's all over. Okay, but a dream, a very sweet dream. Thank you.
We all wish the dream comes true for us.
Talk about Mars dreaming. All four of them dreamt together. Having said that, I took so much of pains to look out for a shirtless Hrithik Roshan, and all you saw were his eyes. Seriously? I agree, ophthalmologist. But you're still women at the end of the day. So, okay, they have tunnel vision. When they see the eye, they can't see anything else. Next.
Why do you want to have a machine between you and
Next team, please come on stage.
Next, I call upon the sensational sirens led by Chandonadi. Let me tell you something. When Swati contacted Chandonadi to be a panelist one of the judges for this, she said, no, I want to be a participant. And that is wonderful of her, and that is Chandonadi. Absolutely, that characterizes her. Someone who never grows old. Chandonadi, come ahead. So these are the sensational sirens, Dr. Chandana Chakraborty, Himani Chatterjee, Brototi Roy, Sneha. Come on there. Who's the first speaker? Okay, we are about to start. Judges ready? Next picture. He gently lowered himself onto the slit lamp before me. Start. Your time starts now.
This huge man entered my OPD and I was looking at him from top to bottom, and I was thinking whether my slit lamp will even accommodate this person. Then he came walking slowly towards me. He could barely balance himself. He was almost tilting. There were two people holding him from each side, trying to push him towards me. And then I said, please, sir, have a seat. And then he sat himself down. And then my chair was also very creaky and couldn't balance him. He fell down on one side. And then I had to lift him up from the ground. And then I placed him tenderly on my sofa. I told him, please, sir, you have my seat. And then he said, forgive my weight. And then, what is your complaint, sir? And then he said, while I was fighting, I am a sumo wrestler. While I was fighting, someone hit me in the eye. And then to the next person.
Hello, Brutoti. You have sin. You have, Brutoti.
Please note, they have to speak for 1 minute. No giving up before 1 minute. Gets you negative marks.
Dr. Brutoti has not, have you checked the intraocular pressure of the patient? Because he is a constant steroid taker. You should take. And apart from the intraocular pressure, I think you must have seen the slit lamp also. You could examine the slit lamp that whether the patient has got cataract or not. I am not going to examine this patient. I think junior, they are the best person to tackle this patient. In my age group, at the age of 60, with osteoporosis all over the body, I am not the person to tackle this type of candidate in my clinic. Why the patient has come to an government sector here? He should better go to I think I'll find out someone who can best tackle.
Good afternoon, sir. My consultant has asked me to examine you. So at first, let me introduce myself. I'm Dr. Himani, and I'll be checking your intraocular pressure first. So, sir, can you please place your chin over here? So he just sits down again on the slit lamp, and he places his eye on the chin rest. And I'm like, no, sir, please, sir, move back. So you should place your chin over the chin rest. Okay, he moves forward, and his belly pushes the slit lamp away towards me. And I'm like, I'm thrown away from my seat. And I'm like, sir, please, I'm sorry, it's my mistake. I should have been more bulkier to handle you. I'm so sorry. Sir, please place your chin over here. And someone please put the parakin on his eyes. Otherwise, he won't be able to help me with the procedure. So he finally helps adjust in the seat, and then he sits down, and I could check his intraocular pressure. But After checking, it's too high. And so I request my senior to check the retina.
What have you sent me, Himani? I can't even see. Okay, just let me put my IO up. Oh my God. Okay, hello, sir. Please have a seat. Dr. Himani has done a wonderful job checking your anterior segment, and your pressure is high. I need to have a look at your nerve. I'll just give you a dilating drop. It won't take that long. Please have a seat. बाप रे, इसको जल्दी से dilate कर. ठीक है. Okay, after 5 minutes. Sir, सब ठीक? I'm seeing a bit blurry. Sir, it's normal. You will see blurry. But, okay, fine. After another 10 minutes. My eyes have become more blurred. What have you done? Please, sir, don't shout. It's just normal procedure. It will dilate and we will see your retina. Please put your chin down. Look towards your feet. Oh, towards your belly, sir. Oh, fine, sir.
Over, done. Okay, so I'm glad we still kept the sumo wrestler in the clinic. The next team comes up. This is the first time we are doing tall tales. So here's a hint for the other teams. Make your stories tall. You can take your patient out of your clinic. You can take him anywhere. You can change him from a human being into anything you like. Tall, ladies. You are competing with the men to make tall stories. You've not even come anywhere close near them. You've got to beat them at their game. So the next team. The next team is the Devilicious Divas. Ready? Okay. Next slide. Come ahead. Next slide. The nation held its breath as I picked up the keratome. Time starts now.
So the nation held its breath as I picked up the keratome, but I was hardly ready for it. I am just a young ophthalmologist who is out of a residency. Is this even possible for me? But no, this is not a cataract surgery. That is not what the keratome was for. This person had walked into my clinic, much to my dismay and a lot of great pleasure, because why would he come to me? He just came because he had a red eye. And how did he get the red eye? And why would he come to me? It was 15th of August. There was nowhere he could go. And apparently, I was the only person he could come to in my clinic. So what had happened to him? He had gone to a party. And what happened at that party? At that party, there was a lot of crackers and festivities. And one of those confetti crackers, they suddenly blasted at him. And then, what was he supposed to do? He came with irritation and foreign body sensation to my clinic. So I was not supposed to use the keratome, but...
So, Mr. Sachin Tendulkar, I'm a great fan. Sir, why is your eye so red? Why do you look like you've bitten by a horde of bees? Says confetti crackers have gone into my eye. I'm like, oh, that's a very grave dismay. What can I do to you? Can I look into your eye? And to my disappointment, I see that it was just not confetti crackers. There was some other discharge too. I said, sir, what did you do? Did you try to manage it on your own somehow? And he said, sorry, ma'am, I should inform you that I was trying to wash my eyes. And then I tried to look I couldn't see anything. Both my eyes were blurred and blinded. And then I went in, I got a glass of water on the basin and I washed my eyes and I don't think it was water. Was it something else? Was it something burned my eyes a lot? Was it a dishwasher or was it a sanitizer or was it alcohol in fact? And so then I tried to dry my eyes. I went and tried to dry my eyes with something sort of a hand dryer or a blow dryer. And this is what has happened to me.
So when I examined the anterior segment, all I could see was redness and a very irritable looking eye. I asked him, sir, what did you use? He said, I don't really know. Somebody handed me a glass of something and I put it in my eye and it started burning even more. I think, sir, it was alcohol. Did you take alcohol at the party? Maybe. But sir, now I have to examine you. I need to take the keratome because I don't have anything else at my disposal. And all I could think was, if I injure even a vessel in his conjunctiva, the nation would literally kill me because he won't be able to see the ball. Keep speaking, keep speaking. So, as I was excited, I could not leave him as well. I tried to do something. I don't know what my hands were doing because my mind was blurred. And all I could think was, I need to get a selfie with this man. So I just tried to do something with my keratome, just take out the epithelium of the cornea.
Okay, so now I thought I would wash his eyes first with saline water. But again, my hands were trembling that if I do any mistake, I thought if I again mistake the sanitizer to be saline water, but then, okay, fine. I first instilled paraffin to his eyes. And once I gave the paraffin, he said, wow, that worked wonder. Now I'm doing fine. I don't have any problem anymore. But then that was difficult to convince him, no, I'll have to treat you further and you will have to apply drops and ointments to control your problem. And this is a chemical injury and you will have to use all the drops. And, but at the end, when he was provided with the treatment, he was very happy. And I did not miss this opportunity to take a selfie with this one I injured Sachin Tendulkar. And that I would treasure for my lifetime. And I will have a story to tell, to share with my colleagues and friends. So that was, I was very, indeed a great day. And
Okay, so that was the end of another tall story. But before they take your seat, Dr. Madhurima, I have one question for you. Sachin Tendulkar walked into your clinic, right? That's what you said. My question is, what were you doing in your clinic posing with a keratome? Seriously? And what was that somebody doing with a keratome in your clinic? You are a dangerous person, believe me. She sits in a clinic with a keratome in hand and poses for it. Right. She says days are dangerous. Chalo, at least she's going to defend herself with a keratome. Next we have the mesmerizing Madonnas, led by Dr. Suchanda Sar, Dr. Anuradha Chandra, Dr. Aditi and Dr. Shruti. His eyes were bloodshot and his steps faltered as he walked into my clinic. Go.
Oh, my next patient, ma'am, there's somebody waiting for you. We have to bring him in on a priority basis because he seems to be disoriented. Yes, please do. His name is Salman Khan. Salman Khan, acha. Ashok, I have Keta. Oh my, this is the real Salman Khan. Bloodshot eyes. Oh God, again an attempt by those black stag people, those people who are trying to kill him. Ma'am, the clinic is surrounded by some people. Somewhere in Rajasthan, he has shot a black buck. And those people are behind him. And this person was running, and we realized this is Salman Khan and we have given him some, we've brought him into the clinic, ma'am, to just protect him from these guys. Okay, let us now close the doors. Please bring Salman Khan to the next room. Let him lie down. And I'm going to go outside and meet this black buck.
So we have an AI clinic and we have a robot. So we asked that robot to first check him whether he is fit enough to be seen on the slit lamp or he has to lie down and we have to see him. So when we saw his Glasgow scale, he was near to 2. And that was not because he was hit, because he was taking alcohol and he was completely disoriented. When we asked him for vision, he couldn't say anything. And so when we saw his pupils were miotic. And when we, so we were thinking that, is he taking something else? Only alcohol or something else? Is he taking cocaine? So there was this person who
could not be disoriented. He has pupils which has miotic, so it looks like a cocaine poisoning. So I asked immediately our a medical physician who is present there.
Time up, next one.
Yeah, so his eyes were bloodshot, his steps faltered, he wasn't able to walk. But we examined, but he said that he had not taken any cocaine. He said, टाइगर कभी कोकेन नहीं लेता, टाइगर जिंदा है, मैंने टाइगर को नहीं मारा. These are the black bug guys, and these black bugs, they have invaded into my territory, and on top of it there are people who are trying to kill me because they revere black bugs. So all these court cases, guys, this is a false case. I have never run over anybody, I haven't killed over anybody. Save me from these people. That's the reason I have walked into your clinic, and not because I need any treatment from anybody. I'm a good guy, I have never done anything wrong. So we were like, okay, we agree, you haven't done anything wrong, and we'll provide you full protection in our clinic, provided you give your guys to our clinic to help us from all the medico-legal complications we face here, and from all the mob attacks we might face in future, and do give us our autographs.
So of course, Bhai smiled at us with his do mast nain, and of course, दिल का ले गए चैन. भाई को किसी से डर नहीं लगता, दबंग को किसी से डर नहीं लगता, तो why should we be afraid? We very well did our duty. We checked his eyes, we saw everything was right, we prescribed him the medications. And what do you do when Salman Khan is there? Of course, you ask a little bit of gossip about Aishwarya Rai. What about Aankhon ki gussa kiya? Just asking. And what about Katrina Kaif? Of course, you want to know a little bit of Bollywood gossip. Why not? After a very tiring day in the OPD and OT, right? And what about the guys who are waiting outside? Of course, you tell them. When Dabang is inside, what can you do? Not that he is Don. 11 मुल्कों की पुलिस उनको ढूंढ तो नहीं रही है, तो मैंने भी अपना काम किया. सलमान खान के साथ एक डांस किया और बोला, when he asked me, आपको डर नहीं लगा डॉक्टर साहब? I said, थप्पड़ से डर नहीं लगता है, प्यार से डर लगता है. Thank you.
I was almost regretting the fact that I've given them Hrithik Roshan, Salman Khan, Sachin Tendulkar, and not one of them has proposed marriage to them, expressed their love for them. But Aditi, you, okay. But Aditi almost made up for it. So that's good. Now the next one. The next team and the very last team. The stunning senoritas, Dr. Madhura Mukherjee, Dr. Bidisha Roy, Dr. Deepsha Chakravarti, and Dr. Sampurna Mukherjee. And I do believe we have the best for you.
Oh my God.
I watched in... 1 minute. Can you stop it? Okay. Stop it. Start the timer again. Stop. I watched in stunned fascination as the nucleus gracefully sank into the vitreous. Your time starts now.
I was in the OT. And whose face did I wake up and see before walking into the OT that morning? It's okay, it's just a normal day. I get washed, I walk into the OT, get scolded by my consultant for being late, obviously. And then I start arranging the table. I arrange the table, and then my consultant walks in, very flustered, as he is always very flustered. He comes in, he sits and tells me that we have a very, very, very high profile patient and we need to get that patient operated right now. Okay, fine. The consultant starts operating, okay, and okay, everything is going fine. He gives the incision, he puts the phaco probe in, and something is going wrong. Either the phaco machine sound is not working properly, or he's asking me, he's scolding me more than usual.
Next.
I ask my friend to assist him.
Okay, so তোমরা ওটিতে সবাই খুব আওয়াজ করছে, and I just heard somebody saying, সবাই চুপ করো তোমরা, চুপ করে বসো তোমরা সবাই বসো. And then then I get to see somebody who is being draped, and I feel that there is some lady who is being put on the table. So I ask my colleagues ki uni ke. So they say that uni hocchen amader pishima. So I say, okay, what is wrong with her? Then it seems that they say that don't talk in front of this patient, otherwise you will get missing Lokhir Bhandar. So I said other of my colleagues, and I refer her that I give that thing to my retinal surgeon that.
So now the patient who is a VVIP, and she enters into the OT, and now the VR surgeon takes care of the nucleus that is in the mid-vitreous now, and and then he plans for IOL, and then the IOL is put in the posterior chamber, and his hands were really trembling during the process because outside there were huge gathering by the by her political supporters, and in the news Modi ji was in a meeting, and he was suddenly somebody whispered in his ears that this event is happening, and
Time up. Next speaker. Time starts now. First.
So finally, my consultant could solve the problem, and Ms. Banerjee, she was very, very happy with her. So all my juniors and my co-residents, they came up to me that you were in the OT, so why don't you go and ask for something nice? So I went up to madam and I said that, madam, can you please plan, give us a treat? And she was like, why only treat? I'm going to give you a vacation to maybe Andaman. So you and your entire team, along with your juniors, you can have fun over there. So not only we went to Nobanno, and we had a very nice lunch. It was a gala lunch, and after that, with all my team, we went to Andaman, and we had a fun time. We ate fishes, and we went for swimming, and we went for all the water rides, and all our patients back here, they were just screaming outside the
That's
hospital.
it. Enough of your this is what I call a fantasy. Going to Andaman and having fishes with Mamata Banerjee, that is a fantasy. Having said that, have the judges finished marking? Well, when I gave this one, see, you were supposed to start with the nucleus falling into the vitreous, and I was hoping you would end with evisceration of the eye. Let's just say I'm a little disappointed. Now I have won. The competition is over, but I would like the 4 adults who've been sitting there so comfortably and judging the EVAs to come up here and do the last one. And come on. All 4 of you. Parakda, lead the pack. Rudro. Come on. Yeah, of course. See, Rudro, come. Shurjo, you're my street fighter. Come on. One of the...
This is biased.
I'm not giving you this. I'm giving you a totally unbiased one.
Doel, I'll just tell you one thing. It's much easier to criticize people than to be...
I agree with you. That's
judged.
why
Judging is a far easier...
Why do you think I'm on the other side of the fence? It's always to hold the mic and be clever when you don't have to do it. Ankita, there's one more. This one is an easy one. See, I've been talking about it all the time. The Prime Minister walked into my office with a black eye, and Parakda, your time starts now.
It was the day when Ajodhya Mandir was puja started, and every people rushed for the temple. Though our PM, with all the security guards, tried to face people as a pre-vote campaign. So suddenly the rush hit him and he had eyes there. And I was eye practitioner at Gujarat myself. And so he came to my chamber, same story, that all the other doctors' chamber were closed and mine was open. I examined Dr. Modi, our Prime Minister, and put him for the ultrasonography person and waiting for the report whether any intraocular event has
Time up. Rudra, can we
happened
bring
or
in
not.
Rahul Gandhi now? Come on.
Actually, I was sitting in my chamber idle, and my assistant told, sir, old man with an white beard and white hair has come to your clinic. You send him. He has come for a medical certificate. I mean, who is the person? Well, no, he was telling that his name is Mr. Modi. Okay, let him in. Mr. Modi came to my room and told me, yaar, mere ko ek medical certificate chahiye. I want a medical certificate. It can be false. You just write in your prescription pad that I have fallen in my bathroom and with your black pencil draw a black thing around my eye. I told him, it's already black. No, I have already fallen, but you make my another eye black. Then I told that you will be a raccoon sign patient. People will make fun of me. No, I want leave. I want leave for another 15 days. See, I have made a terminal in airport, Delhi airport, and it has broken. People are behind me. So please pardon me and leave me and grant me a leave for 15 days. I will apply to the president.
Next, Shujjo.
मित्रों, I went to Rajnath Singh to tell my Man Ki Baat, and this is what I land up with. अब आप लोग अपने मन की बात मुझे बताओ, क्योंकि पिछले 15 सालों से मैं अपनी ही मन की बात बता रहा हूँ. So that's why I have come to your clinic. I don't think my black eye requires any treatment. But if the other eye is not black, please also give the other eye a contribution for black eye so that I can share my Man Ki Baat again on TV and tell you people why I got this black eye. But the reason he has come to my clinic or our clinic is probably because this is the only clinic which is going out of business. So we stand to lose nothing. And I see no other reason for us treating this person other than the fact that...
Time up. Arnabda, start.
So मित्रों और कहाँ जाएंगे, मित्रों के पास आएंगे. तो ही said कि सामने तो मित्रों लिखा हुआ था, तो मैं इसीलिए आपके पास आ गया. और बाकी सारे लोगों ने मुझे कहा कि ये चोट लगने के चलते हुआ है. लेकिन नहीं, मैंने तो आंखों में थोड़ी सूरमा लगा ली थी और ये सूरमा थोड़ा बिखर गया. And that is the reason why I am here. लेकिन आंखें हैं, तो आप बताओ कि आगे हम क्या कर सकते हैं, हम कहाँ कहाँ जा सकते हैं, किससे बातें कर सकते हैं और कैसे इस राहुल गांधी से पीछा छुड़ा सकते हैं. आपके पास बैठना, आपसे बातें करना, मन की बात दूर की बात, मैं अब सिंपल आपके साथ कुछ समय गुजारना चाहता हूं. और who else than a मित्रों for my मित्र. मोदी जी साथ बैठे रहें, हम उनसे बातें करते रहें और ये जिंदगी भर की एक उपलब्धि सी बन गई कि कोई एक ऐसा इंसान तो मेरे पास आया जो कि मेरे पास इतनी देर बैठा रहा.
Thank you, Arnabda. So, big round of applause for the judges. I think they came mentally not prepared for this, and then I think they did a wonderful job of it. So finally, we have the results. But before I say that, I would just like to say that this is the first time that we had something like Tall Tales at the request of Swati. And I would like your feedback if it was worth it and if, how can we improve on this and whether it should continue or not, whether it was entertaining enough. And now for the results. Any guesses? And I don't know if Aditi is because I have forgotten who is in which team, but the winners with 379 points are the mesmerizing Madonnas. So big round of applause for that. But having said that, I would like to say that each one of the people who participated are winners. They were doing it for the very first time, and most of them didn't even know the concept of it till they came here. So a big round of applause for all of them. And a very special thank you to Tulika, who has done the tabulation. She's the, in case you don't know, she is the official tabulator and scorekeeper of OSWP. So a big round of applause for her. And on that note, all those who haven't had lunch, lunch is awaiting you. Over to Swati.
Thank you, everyone. Please collect your books before your leave. And I would like to thank Doel Di, Tulika Di, who were with us from day one, and Dr. Kajal Ghosh sir staying back for chairing this session, and Dr. Vaishali Vasavada ma'am flying all the way from Jaipur and making our Ophthaevas and even the Adams feel so special and inspired. And we learned a lot from everyone. Our Secretary Sir, Dr. Debashish Das Sir of OSWB and Chairman Scientific Committee, Dr. RKB Sir, and all others, not naming one, but all the EVAs. 3 cheers to you all. And I would say a special thank you for Ajanta Pharma, the 5 divisions who have been a supporter in the journey of Ophthaeva since 2017. They have with us for every program, and we look forward to their continued support in the future. And they have been a wonderful in organizing and, looking after all the tits and bits, and we were so stress-free for the entire thing. Thank you, everyone from Ajanta Pharma, not naming anyone, but definitely all of you. And the audiovisual team, Shogoto Burman and Altair, for giving us the premises, and we really enjoyed this. Yes, would call everyone for a group photograph. And
बात तो अभी खत्म ही नहीं हुआ. She left it incomplete, no? Yesterday's that tall tale. So actually, now let me tell the whole story of it. The original story is she has borrowed all those pictures from me and Devashish Da, which we have enjoyed yesterday night after this India won, till 4 a.m. at night, and all the pictures was from, actually it was edited picture. We two were together with all of them, and the sumo wrestler was the bodyguard till 4 a.m. And rest of the thing is, Doel, your patient is doing well.
so requesting everyone to come forward for a group photograph. First, the tall tales people, you can come forward. Dr. Vaishali, please come forward. All the panelists, judges.
Dr. Chandana Chakraborty, Dr. Chandana Chakraborty, Dr. Himani Chatterjee, Dr. Bratati Roy, Dr. Sneha Jain. Please come up. Little token of appreciation. Dr. Chandana Chakraborty. Dr. Himani Chatterjee. Dr. Bratati Roy. Dr. Sneha. Dr. Sneha. Next, Dr. Oindrila Das. Dr. Debolina Bhattacharjee. Dr. Madhurima. Dr. Madhurima, please come here. Dr. Rituja Das. Dr. Suchanda Sar. Dr. Anuradha Chandra. This is the winning team coming up. Dr. Aditi, Dr. Shruti, Dr. Shruti, Dr. Madhura Mukherjee, Dr. Madhura Mukherjee, Dr. Bidisha Roy, Dr. Deepsha Chakravarti, Dr. Sampurna Mukherjee, Dr. Sampurna, Dr. Shashwati, Dr. Debarauti Mukherjee, she's not here. Dr. Kalpita Das, Dr. Rituparna Chatterjee. May I now request the judges who have done a wonderful job of judging as well as speaking after that. May I request Dr. Kajal Prasad to hand over a token of appreciation for Dr. Vaishali, who was a last-minute judge, totally unprepared for it. Poragda, Dr. Porag Mukhopadhyay, Rudro, Onobda, Rudro, Onobda, and Dr. Shudra Gupta, who's not here. Dr. Mohua and Dr. Shupurnadi, who began this entire program in the most beautiful way with an auspicious tune, so to say. I know.
And also Dr. Doel Biswas. Doel. Followed by Dr. Swati Agarwal. You're next.